Now let's talk about a very important doctor that uses Kangen water in his practice, Dr. Hiromi Shinya, MD, PhD. Dr. Shinya retired in 2012 as the professor of surgery at the Albert Einstein College of Medicine in New York City. He was also the chief of the endoscopy department at Beth Israel Medical Center, also in New York. Dr. Shinya is one of the top 10 surgeons in the world, one of the top 10 GI doctors in the world. He actually co-invented the colonoscopy. He was the first doctor in the world to perform a colon polypectomy, which is the removal of a polyp using the colonoscope. It's actually called the Shinya method. Ask your GI doctor if they've heard of Dr. Shinya. Of course they have. He wrote the book on it and he invented the technology. Dr. Shinya has overseen or performed over 370,000 colonoscopies. He's kept clinical data over a 45-year period of lifestyle and what people put into their bodies compared to their colon health, and he knows the direct correlation. Now, part of his protocol for cancer patients is they had to agree to drink 3 liters of Kangen water every single day. Now, this is some of Dr. Shinya's work. This is a colon of a 45-year-old female with breast cancer and chronic constipation after 2 days of prep. That's 2 days of laxatives to clear out her colon so they can take some pictures of it. This is 90 days later, 3 months after treatment. Now, Dr. Shinya does not sell the water. He's not a distributor for the company, but he knows the power of this technology. One more. This is the colon of a 65-year-old female cigarette smoker with breast cancer. You know how with cigarette smokers they say the lungs turn black? Well, the colon also turns black. The body is overwhelmed with toxins. 3 months later, 90 days later, and she has a very clean colon. Dr. Shinya figured out how to get rid of the toxins inside the body. Take a look at this short video on more of his work.
In 1968, Dr. Shinya successfully developed the technique of colonoscopy in order to visualize the entire rectum and colon. The following year, in 1969, he devised a snare cautery device and was the first to perform colonic polypectomy through the colonoscope. He has performed approximately 300,000 colonoscopic examinations and has noted that there appears to be a strong connection between intestinal appearance and lifestyle-related diseases. This video depicts a variety of different intestinal views, good and poor, related to various